My name is Joseph Tanenbaum. It's an honor to present today on behalf of Northwestern here at OREF. My topic is the natural history of ulnar collateral ligament injuries in professional baseball. So the animating work for this project was a study that came out about 10 years ago, where the folks at the San Diego Padres organization surveyed MLB team physicians across the country and asked them, based on a series of clinical vignettes, to rate the risk of injury recurrence for players who had had a UCL injury. And their grading system went from 1 to 5, 1 being this player has minimal risk of re-injury, definitely draft them, definitely sign them, and a 5 being very high risk. And so just curious what the audience thinks. So the first scenario they posed was a 22-year-old collegiate pitcher who'd had a Tommy John surgery 2 years ago. They'd returned to play. They played a full collegiate season with no residual pain. Who in the audience thinks that that would be a high risk of recurrence? All right, nobody's really raising a hand, so we'll keep going. Now, in the second scenario, this was a player who had Tommy John surgery 1 year ago. They had returned to pitching at their prior level of velocity and performance, but hadn't yet returned to a game. Now, my plan was to ask you all to vote high risk, low risk, but I don't think I'm going to get a lot of participation after the first one. And then in the third group, they had surgeons look at players, again, 22-year-old player, had a UCL injury a year ago, but it was just a sprain, wasn't a tear. They did not undergo surgery. They chose to rehab it. And again, they were able to return to pitching. They pitched a full college season with no pain. My plan was to ask high and low risk, but all right, why don't we just see what they did? So in the initial study, about 73% of surgeons rated that first player as a 2. Some rated them as a 3, so mild to moderate risk of re-injury. The second player was about a 3 on average. About 75% of the surgeons said that they were a 3. That's a moderate risk of recurrence. And lastly, that last player, a little bit more all over the map. We don't really know whether it was mild, moderate, or high risk of injury recurrence. And so, these risk estimates, which are used across the board in a lot of different sports-related studies and practices, may not be based on evidence. And so what we wanted to know is how we should rate re-injury risk for these players. And so to do that, we looked at UCL injury recurrence rates among professional baseball players. And we asked whether recurrence rates varied by initial treatment modality. So how did we do this? We took data that came straight from Major League Baseball for season 2010 to 2021. This is from their internal EMR. And we looked at every documented UCL injury for any type of injury, whether it's a complete tear, a sprain, or just really pain in the elbow. And the way this works is, for example, say a player blows out their UCL in 2018. That player's MRN gets included in the database. Say that player then rehabs it, does a great job. They go back to pitching and hitting in some cases, I guess, wins an MVP. And lo and behold, 5 years later, they have another injury to that same elbow. That player's MRN would show up in both 2018 and 2023, but their injury would be flagged by unique event identifiers to indicate that these are actually 2 different injuries. And we chose to look at the 5-year recurrence rate because the average career longevity of an MLB player is about 5 seasons. So when you look at all comers, when you look at all UCL injuries over this time period that we studied, about 10 to 12% experienced a recurrence within 5 years of their index injury. And the median time to experiencing a recurrence was about 2 seasons. When you looked at players who initially underwent surgery, those players had a much lower recurrence rate. They also had a lower return to play rate, as you might expect, but those players had about a 5 to 7% risk of recurrence within 5 years. If you looked at players who were initially managed non-operatively, so that third bucket of players in the vignettes, you actually see that their risk of recurrence within 5 years was much, much higher. And interestingly, we also have started to look at what happened to players when they had a recurrence. Did they undergo surgery? Did they try to non-op? And over time, what we've seen is an increasing trend towards actually operative intervention if you have a recurrence. Now, again, these data are biased, or the comments I'm making are biased because a decent number of these players never returned to play at all. So within the context of players who are able to return, that's an important thing to think about with this study. So going back to our original vignettes, that first player who's able to return, they've had 2 years since their injury, right? They've returned to their prior level of performance. That's a relatively low-risk player for recurrence. The second player, if they're cleared to play again, we would estimate probably also pretty close to that 5 to 7% recurrence risk. And the last cohort, that player who doesn't have surgery and just attempted rehab, they have a much higher risk of recurrence than the other patient cohorts. And so our hope is that these data are used across the board by teams, by Little League coaches, everybody across the board to better inform our understanding of these injuries. And so with that, obviously, we'll take any questions in a moment. Thank you.